Hello, my name is Dr. Joseph Danyo. I'm a board-certified plastic surgeon in Greenville, Delaware. We are just minutes from downtown Wilmington. And today we're going to talk about otoplasty. And otoplasty is basically, in layman's terms, pinning back the ears. And it's a great surgery because it's surprisingly simple to do and produces such a dramatic result. It can be done for children or adults. In my experience, it seems to be equal amounts of both. And children typically become aware of their ears and oftentimes the playground sort of scenario with the teasing and things sometime around age 6 or 7. So that's a common age to do a otoplasty. And same thing with adults, they have the same problems, and basically a prominent ear is due to either a poorly folded ear. This is called the antihelical fold, and some children or adults will have essentially no fold here, or at least it's poorly formed. And so the aesthetic goal is to basically create a crease along the inside of the ear by basically using sutures and or a cartilage cutting technique to basically fold the cartilage back. Oftentimes there's more than one problem with an ear, and so you can also have a prominent concha, or basically bowl of the ear, and how that presents is the ear tends to stick out along the inner rim here, and when you look behind the ear you see a lot of that bowl from behind, and so that can be treated by basically an incision behind the ear and removing cartilage and either suturing it back towards the scalp or just simply removing the cartilage that's extra and restitching it. Oftentimes the actual ear lobe can be prominent or tilted forward, and that's a simple maneuver to basically fold that back with skin excision. Typically both ears are similar but not identical, and you'll do slightly different techniques or folding or cutting techniques to produce symmetry. And the goal is to have a natural ear that looks normal and non-surgical. You don't want to produce a plastered ear or an ear that appears to be stuck onto the side of the head, because that's an overdone ear, and that's not necessary. What's nice about otoplasty is that it's a basically an on-table result, so everything you do will be what it will appear like in the future. So you don't have to imagine what will be present in the future, because you're creating it in front of your eyes. Simple surgery. Sometimes minor procedures can even be done here in the office under straight local. Can be done under sedation and general anesthesia if you prefer. It's always outpatient. Very, very little pain. Very little external evidence that anything was done, even just a few days later. I do have patients wear a headband style a garment at night for about 2 to 3 months, and then after that basically nothing's needed. So that's basically otoplasty. If you would like to set up a consultation, please call my office at 302-888-0508, or you can reach us through our website at danyobamburyps.com. Thank you.